okay?
Yeah, I'm fine. I'm fine.
Well, someone's very chuffed with themselves. Morning.
Yes, I am, and that is because I didn't waste my night at the gym last night, but I finished off my assessment presentation and emailed it to Heston, who by now will be dazzled. Heston, did you get it? Sometimes I have problems sending attachments.
Tell me about it.
Heston.
Yeah, right, yeah.
I remember my final presentation. It's a really funny story.
Did you see that?
See what?
Heston, as soon as I mentioned my presentation, he barely looked at me, he just scarpered.
You're being ridiculous. Again.
I can't make it this afternoon. I'm not feeling 100%. Yeah, but I should be rested for tonight, so, fine. See you later. Gotta go.
Who's that?
It's a mobile company. Pain.
Were you okay? I noticed your breathing wasn't right last night.
I'm good.
You'll be okay for tonight.
Come in.
A word?
Yeah?
It's about the final version of my assessment. Something wrong?
Have you read the new RCGP rag?
No.
Sorry.
Don? What's this?
A tissue?
Don. Don't you think you should see a doctor?
Oh, come on. Look at me. Never better.
Why don't I make you an appointment?
It's not the end of the world, really. It's a setback. Nothing...
This has taken the thesis of my assessment and completely blown it out of the water. If I fed my work into the system now, I would like some guy telling Galileo that the world is flat.
I think you mean Aristotle. And please, don't compare Dr. Jeremiah Wadsworth to Aristotle. His ego is big enough as it is.
My career is ruined, and you're correcting me.
It's not as bad as it seems.
My assessment is in tatters. Not as bad as it seems. How?
Well, think of it as an opportunity. If life gives you lemons...
Heston, please. Don't do motivational speaker.
Hi. You settling in all right? Mm-hmm. You sure?
I hope you don't mind me saying, but I seem to have got a lot of home visits, very time-consuming cases.
Well, I think our patients are happy with the service they get, so they always ask for the same doctor. But I'm sure when they get to know you, they'll do the same. I can speak to the doctors, though, if you like, make it a bit easier for you.
No, you're right. And it's the difficult ones that make the job interesting.
Now, take it easy, because you're still settling in.
No, it's sink or swim in my experience.
Dr. Cassidy, Elaine, I have a lady on the phone. Her husband's coughing up blood, but he says he's fine. She's looking for a home visit.
Get her to take him to A&E.
No, it's okay. I'll see him.
Okay, I'll get you the details.
Thanks.
I wish you could take me to the pub and get me drunk enough to forget all about this.
Pubs don't open for another half hour.
We can work around this. Perhaps an appendix taking account of Dr. Wadsworth's research.
Right. So here's my research, followed by someone else's research that says I'm completely wrong. How does that work for me, Heston? If I submit now, I'm going to look like an idiot, aren't I?
Yeah.
It was your job to supervise me and make sure I don't humiliate myself. So well played, Heston.
She's out on the house call.
Oh, yeah, of course. I've forgotten. Actually, I was coming to warn about you, Charlie.
Oi.
Just kidding. Mind you, I do trust that I won't be getting a complaint from her about you some point in the future.
I'm a married man. Anyway, she's a tree hugger.
One second. No, hold on.
Hi, Karen.
It's Ruth.
Oh, sorry, Ruth. Look, I think I'm lost.
Right. What was the last landmark or street sign that you saw?
Well, I've been driving for a few minutes since I passed the train station. But I'm just surrounded by houses. I'm sorry, that's not much help.
Do they have GPS in Norfolk?
She just passed the train station.
Elaine, Daniel. I hear you've just passed the train station.
Yes, Sutton Vale, I think.
Okay, I know the area a little bit. Let's see if we can help you.
I'm sorry to hear about your assessment.
Does everyone know about this? Who's next? Mr. Davis.
Good morning.
Hi, how are you today?
He'll say, well, you'll hear what he'll say. Sorry, did you have any trouble finding the place?
Oh, not really. Don, Dr. Cassidy. Carol has some concerns about your breathing. How about we go into the living room and I take a look?
Well, how about we don't?
You've been coughing up some blood.
No, that was blood on a hanky, but that's because I've been brushing my teeth a little bit too vigorously. I'm tired, I'm overworking, I'm nervous about a show I've got on tonight.
You're nervous?
Yeah, I'm really sorry about this, but this is totally unnecessary.
What's the show?
I'm a musician, I play the trumpet. I'm playing a Haydn trumpet concerto.
What's the name again?
Don Brun.
I know your work. I used to listen to it with my ex-boyfriend. I enjoyed it very much.
Oh, so what CDs have you got?
Me? None. They're all his.
Well, why don't I sign a few and a couple of house seats for tonight? Make him jealous.
He's very good at changing the subject.
Well, he's had the symptoms of Parkinson's disease for a year. He hid it from everyone and took an unlicensed drug. Stupid.
Shame.
So, what do we take from this then, apart from never trust consultants bearing gifts?
Well, we have to be extra vigilant of our student doctors. They are under enormous pressure, not just to be good or capable, but exceptional. I mean, look at Simon.
For the Parkinson's disease, I mean, how long could Michael have been covering it up?
Well, in theory, for a long time. I mean, it would have become increasingly difficult.
So what are the symptoms then?
Well, the early symptoms are quite subtle.
So it's easy to hide?
Well, it gets harder. Sluggishness can be a giveaway. But in the end stage, with arresting tremor affecting both sides of the body, apathy and depression, it's obvious.
But let vigilance be our watchword.
Absolutely.
Esther, can I have a minute? I've got a patient who's concerned he might have a melanoma. I think it's probably just a seborrheic wart.
Have you inspected it?
Yeah, slightly elevated, looks a bit flaky.
How old is the patient?
48.
I'd expect you to deal with something so basic.
I know, I just wanted you to double check.
Trust your own judgment.
Given that my judgment was so wide of the mark with my assessment, how can I trust it?
Simon, your judgment is sound. I trust you. Now go.
Oh, yeah. No, Liam's fine. Ocean's, well, the same. Marlin is adorable, of course. Listen, I just wanted to ask you something. You know, before Grandad died, his hands used to tremble a lot, didn't they? Oh, you sure? I guess my memory must be playing tricks on me.
I agree with you, there's something wrong. His breathing's shallow and raspy, and no matter how little coughing up blood is a concern, he really should get his chest x-rayed.
He won't listen. He's fixated on that performance tonight, and I've never seen him nervous before a performance. Is he well enough to perform?
If he played anything other than a wind and a brass instrument, I'd probably say yes.
What's wrong with me?
I haven't examined you, so it's very hard.
So you don't know?
Not yet, but there are indications of a lung problem.
I've never felt better. I've never smoked. I'm fit. I run. But for some reason, you both want me to be...
I don't want you to be ill.
There are people out there who really need your help. I don't want my wife wasting any more of your time.
These are great seats. My ex would kill for these.
Julia. 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 Sorry. Sorry, I was miles away there. Are you okay? Yes, I'm not too lally.
You asked for these?
Oh, yeah.
You called me?
Yeah, I'd like you to have a look at this gentleman. He presented with a rash and some inflammation of the skin.
All right, could I have a look at your hands as well, please, sir?
He's deaf.
Can I see your hands? Well, it looks like eczema.
I agree.
Heston, why did you call me in here? Honestly, as an amateur psychologist, you're so see-through. Do you really think this is going to build up my self-belief?
You have all the attributes of a fine doctor.
Yeah, I don't need your pity.
He can't hear us.
What I need is an assessment that's an honest yardstick of my abilities and doesn't make me look like a complete idiot. You should have spotted the flaws in my research.
This is a hiccup, nothing more.
A hiccup? That's your diagnosis?
Look, your research was sound, your methods were sound, it's just your conclusion differed from Dr. Wadsworth. That's no bad thing.
Heston, do me a favour. Delete my research. I have.
That was rash.
And don't bring me in here to help with easy cases you could deal with in your sleep. It's really insulting.
I brought you in because the patient is deaf, and that brings other challenges. It's very valuable experience. Oh, right. Yeah.
Hi. I'm still wrestling with the computer system. Could you call up Don Bruin's history for me?
Yep.
Thanks.
There we go.
Heston saw him a month ago.
That's right. Don Bruin, trouble with his breathing, early sign of a lung problem. Just wanted a pill to make it go away, if only. Come in. Played classical trumpet, if I recall. Thought I'd be impressed. Didn't realise that trumpets in a classical setting is not really my kind of thing.
His breathing problems haven't gone away. Now it looks like he's coughing up some blood. Not a lot. Still, I think he's in denial.
Well, if people won't listen to the truth, what can you do?
Well, you've got to do something. He's clearly ill.
Oh, Heston, I had this idea. I thought I'd run it past you and Julia. I think that perhaps you should invest in a GPS system for new staff, like Elaine. Stop them getting lost. What do you think?
I think I'll be able to find my way around. Excuse me. Could you point me to a portable spirometer and call Carol Brune? Tell her I'm coming back to see her husband.
I'd like you to keep an eye on Simon, show him some support.
Sure. He's being a drama queen, though, isn't he?
Well, you know, he's upset, understandably. He's put a lot of time and effort into his assessment, and I mean, it's all solvable. He asked me to delete his work.
Did you?
Well, of course. It's what he asked for.
How How was it?
Oh, it's good.
The doctor called. She's on her way back. She wants to do a test. Nothing to lose. Just do it and that's it. Put your mind at rest.
My mind is at rest.
OK, then it'll put my mind at rest.
Look, Carol, I've got you. I've got a lot of musicians depending on me. I can't be sick. I just can't be sick. And actually, I've never felt better. I'm in the best of health.
No, you're not.
Yeah. Look, I'm going to take a shower, then I'm going to rehearse.
Ruth, hi. Tell her I'll be there in a minute. Excuse me?
No, I've got to go. People are depending on me.
They're not important. This is important. Just give her a couple of minutes.
Oh, good. Good, I caught you.
Julia, I've got the... Don't you wait to be asked before you come in.
Thank you. Right, the taxi's on its way.
Listen to yourself, you can't breathe properly.
This is a spirometer. It measures the volume of air your lungs expel. I've got past readings, so it should give us a good picture of the condition of your lungs. How far do you run in a day?
I don't know, I do half an hour.
And you ran today, like that?
Yes.
I know you went to see Dr. Carter recently.
You went to see a doctor?
That was another matter.
No, it was about your breathing.
Why didn't you tell me?
I understand. Men don't deal with illness. It makes you feel vulnerable, out of control. Men don't like losing control. Just do it, and we'll know.
No.
I tell you what. If you can blow one good, strong, clear note, then great. You're well. I'll leave you alone. You know you're unwell.
I think you should leave now, please.
Your family's history of lung cancer is in your
Shut
medical
up.
records. Your chances...
Get out now!
Wait. Doctor, he's pig-headed. Arrogant at times, obsessive when he thinks he's right. But if he's really sick, whatever I have to do to make him see sense, I'll do it. But give me something to work with, please. I mean, if you really think it's lung cancer.
Obviously, I can't be certain. But coughing up blood's extremely worrying.
Please, tell me it's not that.
He needs to get to the hospital.
I mean, there must be something else you can do.
How many more times have I got to tell you?
Please, don't listen to him!
You will have to get treatment. But if we have to wait for you to pull your fingers out of your ears, it might just be too late.
Right, go leave.
I can only advise you. It's your choice whether you act on it or not. I'm sorry.
Yeah.
I was going to suggest we meet after work, crack open a bottle of red, come up with a plan of action, 2 heads and all that.
I've got to come up with a new idea. I'd much rather do that by myself.
Oh, come on. I wouldn't be surprised if there's another article in next week's rag completely refuting Dr. Wadsworth.
Well, it's not your career, Heston, is it? Just mine.
Yes, I've been very patient with you, Simon, because I know how hard you've worked. But get a grip, man. You're blowing it all out of proportion.
What don't you understand about this? I trusted you to watch out for me. You failed me. Now leave me alone.
HCA, the presence of the HCA has enabled us to increase our quaff targets by what? Oh, hello. Hi, Elaine. Come in. How's it going today?
Not great.
Oh, I've got this presentation I've got to do tomorrow, and I just can't get my head around it at all.
Can I help?
Oh, no, that's very kind of you, thank you, but no, I doubt it. I just won't stick, you know. I must be having a senior moment.
Why do they call them senior moments? I've been having senior moments since I was a teenager.
I haven't.
Once, in the middle of a row with my ex, I called him by my brother's name.
Ooh.
Did not go down well. In fact, I've had 2 already today. Got lost twice on house calls. Same house?
You're new here. That's not a senior moment.
It's my excuse and I'm sticking to it. Sounds like you need positive reinforcement.
Well, only if it's a cocktail.
Lie on the floor.
Sorry?
I'm the doctor, and for today I'd like just once someone to do as I tell them for their own good. On the floor. Come on.
Right. That's it.
Right. Now, close your eyes. Breathe very, very slowly. In. Out. Now imagine yourself at the end of your presentation. The whole room is on their feet, giving you a standing ovation. Is this helping?
Actually, yeah, it is.
My taxi's waiting. Carol?
All the time we've been together, I've never seen you struggle to hit a note.
The doctor was pestering me. She caught me cold.
You think it's lung cancer, don't you?
Please.
Your father died of it, now you...
My dad was a chain smoker.
Look, you can't pretend about this.
My taxi's waiting.
Why don't we get that taxi to the hospital?
No.
Oh, no, sorry.
It's okay, Ruth. It's all right. Come in. Okay. Honestly, you are going to get me into trouble. She's going to tell everybody that I'm losing it. You know, I think it's very brave of you to do what you've done. Leave your life behind. New town, new home, new job.
Doesn't feel very brave. In fact, if I'm honest, it's like admitting that my life back home was a failure.
Well, you're here now. So no failures, just positive outcomes.
I keep telling myself that if you try and help someone and they won't let you help them, it's not a failure. Let's keep breathing slowly.
Dom! The doctor said this might be our last chance to get treatment, when it'll actually make a difference. She's convinced that something really serious...
Are you coming tonight? Back to the concert hall, please.
Can you do a pick-up inside Gatwick? Mr. Statham, Sorrel Avenue. Wants to go to the coach station. Can you put that over?
Wait! Change your plan. To the nearest hospital.
I've got a couple of tickets for the Haydn Trumpet Concerto tonight. I know you're not a great fan of trumpets, but would you like to?
I'm afraid I'm going to have to pass. I've got a splendid evening of research to look forward to.
Okay.
Oh, Elaine, those positive reinforcement breathing exercises that you showed me, they've really helped. Thank you very much.
Good.
Why has my room been turned into a hippie squat?
I can explain.
And what is that smell? It's like embalming fluid.
I just don't want to be scared anymore. Every time I close my eyes, it's there, pulling me closer. I just want it to stop.
We just thought it would be better to put Elaine with another woman.
Why?
Well, because I've always liked the idea of two women together.